Sometimes, when we wake in the early morning light and feel that familiar stiffness deep in the knees, it is not just discomfort that greets us, but a quiet fear that the day may hold more limitation than freedom, more careful steps than confident ones. And I want to speak gently to that feeling, because so many seniors carry it silently, wondering why simple movements once taken for granted now feel heavier, slower, even discouraging. It's a natural part of aging to notice the joints becoming less forgiving, especially the knees, which carry our lifetime of steps. But it doesn't mean we are powerless or destined to accept pain as something permanent. In fact, understanding even a little of what's happening can make the fear soften. As the years pass, the cartilage that cushions our joints becomes thinner. The synovial fluid inside the knee loses some of its natural viscosity, and surrounding muscles may gradually weaken if we don't ask them to stay awake and active. This combination leads to that morning tightness, that little jolt of discomfort when standing after rest, and even the unpredictable ache that comes and goes throughout the day. But the beautiful truth is that our bodies remain responsive at every age, capable of gentle repair, especially when given simple, natural signals each morning that say, "I am still here, and I still want to move." One of the most reliable and soothing habits for seniors seeking stronger knees and more comfortable mobility is a morning warm water routine paired with a slow, mindful knee awakening movement that requires no equipment, no strain, and no more than a few minutes of quiet presence. The remedy begins in the simplest place, your kitchen or bedside table, with a warm glass of water infused with a teaspoon of lemon and, if you tolerate it well, a small pinch of turmeric. Warm water alone increases circulation and gently wakes the digestive system, but it also helps hydrate the joints after nighttime dryness, while the lemon offers a subtle dose of vitamin C to support collagen health, and the turmeric carries curcumin, a compound known for its calming effect on inflammation. This is not a miracle cure. It is a steady friend, a soft helper that works slowly, reliably, and kindly. After drinking this warm mixture, give your body 2 or 3 minutes to settle, to feel the warmth traveling inward, and then begin the second part of the remedy, an easy joint lubricating movement called the knee circle and squeeze. Sit comfortably at the edge of a chair with both feet on the ground. Place your palms gently on your knees. Close your eyes if it feels natural, and let your breath fall into a smooth rhythm. Slowly draw small circles with your knees, first clockwise, then counterclockwise, allowing the synovial fluid inside each joint to warm, loosen, and move. It's a quiet motion, almost too simple to be meaningful. Yet this very simplicity is what makes it powerful. Seniors who use this practice daily often find that the mornings become easier, the transitions from sitting to standing less sharp, and the first steps of the day more confident. After about 20 to 30 seconds of circles, keep your palms on your knees and gently squeeze the muscles around them. Light pressure only, enough to tell your body, "Wake up, we're starting the day." And these little messages help increase blood flow and activate the quadriceps, the muscles that protect the knee from extra strain. This entire practice is meant to be slow, mindful, and almost meditative. The key is consistency. Every morning, before long walks, before chores, before the day begins asking things of you. Over the next days and weeks, many seniors notice subtle but real improvements. The stiff, wooden feeling gradually softens. The knees feel warmer, more receptive, and more stable. Bending becomes a little smoother, and walking feels less like managing discomfort and more like returning to a natural rhythm. Some describe it as a quiet lightness that appears first thing in the morning, a sense that the knees no longer resist motion but greet it with a little more willingness. It won't erase decades of wear, but it can make each day more livable and more comfortable. And that alone can shift your mood, your patience, even your sense of independence. You may start noticing that getting out of bed feels different, your first steps more fluid, and the tension you use to brace for each morning simply isn't as strong. And with every day that you show up for your body shows up for you in return. It's a gentle partnership built on repetition, warmth, and kindness to yourself. Let the warm water become a ritual of gratitude, a small morning promise that says you still care for your health, no matter your age. Let the knee circles remind you that mobility is not defined by perfection, but by persistence, by honoring your joints with movement rather than freezing them with fear. And as you continue this simple routine, hold on to the truth that improvement at any age is still improvement, that comfort at any stage of life is still a gift. With each morning, allow yourself to feel a little more hopeful, a little more grounded, and a little more grateful for the steps you can take, whether they are long, confident strides or gentle, careful motions. You are not alone in your journey, and you are not too late to experience relief. Your knees have carried you through a lifetime of moments, some joyful, some difficult, some unforgettable. And now, with this small daily habit, you are giving something back to them. Keep returning to this ritual, keep breathing through it, keep believing in your body's quiet resilience, and let each sunrise become an invitation to begin again with strength, calm, and trust in the simple things that support us the most.